My name is Ravi Vij. I'm a professor of medicine at Washington University School of Medicine in St. Louis. I'm here to talk about clinical trials, and I would like to mention briefly two clinical trials that we are doing. Both are transplant-focused trials. One trial is for patients who are having their first autologous stem cell transplant. These patients on this trial that is being done at multiple medical centers throughout the United States is looking at the value of MRD as an endpoint in multiple myeloma, and also looking at the role of ixazomib in maintenance and as consolidation therapy for multiple myeloma. So in this trial, patients who undergo a transplant are given 4 cycles of ixazomib with Revlimid and dexamethasone starting about 3 months post-transplant. They have MRD analysis done before and after their consolidation, and thereafter they're randomized to either Revlimid or ixazomib and continue treatment till time of disease progression. And though the trial is about 200 plus patients large, it is not powered to definitively answer the question of whether ixazomib and Revlimid are equivalent or better than each other in maintenance setting. It will at least give us some data in that regard, and especially give us data on tolerability. This is the only trial that is a head-to-head comparison of ixazomib and Revlimid in the post-transplant maintenance setting. The second trial that I'll briefly talk about just got off the ground, and this is a trial for patients who have had a prior transplant and then progress, and thereafter their physician feels that they are candidates for another transplant as salvage. For these patients, trials have shown that another transplant may offer a survival benefit compared to the use of conventional therapeutic options. So in this trial, we are looking at a salvage chemotherapy with pomalidomide, elotuzumab, and dexamethasone given for 4 cycles. Thereafter, patients get their second autologous transplant, and thereafter they get maintenance therapy with elotuzumab and pomalidomide long-term. We hope that we can offer patients even greater benefit with this strategy with their second transplant. One question often asked is what should be the duration after the first transplant before patients can go on to this trial. In this, we are estimating that patients will have had at least 2 years disease-free before they go on to the second transplant, because that is what most physicians would feel as a comfortable period of time before offering another transplant as a modality of therapy.